In the French group, since quite a few years, we have used a sensitive MRD with 6 or 8 color flow in order to assess the MRD in the trials that were using FCR. So we have now over 500 patients that have been treated within these trials that were analyzed for MRD, both in blood and bone marrow, with this sensitive technique that has a threshold which is 10 minus 5 instead of 10 to minus 4. What this sensitive technique brings is that the blood is much more informative because of course we have no patient who has a positive blood and a negative bone marrow. But among the patients who are between 10 to minus 4 and 10 to minus 5, these patients do as poorly as the ones who are MRD positive above 10 to the 4. So the blood becomes much more predictive of what you're going to find in the bone marrow. And if we follow these rules, we can reduce the number of bone marrow that need to be done. So that's already some point. Besides that, we saw that in our patient, the threshold of the bone marrow could stay at 10 to the 4. But we can certainly use with efficiency this threshold in the blood at 10 to minus 5 or even 10 to minus 6. And that's how we're going to follow our patients now. And because this sensitive MRD is very predictive, and it's an easy way because we know that MRD is going to enter routine practice quite soon, and it's going to be much easier to follow this patient on blood and do the bone marrow only when the blood is negative below 10 to minus 5 or 6.